After 15 years as a gastroenterologist, I've witnessed countless patients making the same dangerous mistakes with pork consumption. These errors aren't just minor concerns. They're potentially compromising your health in ways you might not realize. Let me share a shocking case from last month. A patient came in with severe abdominal pain and fever that had persisted for days. Upon examination, we discovered a parasitic infection directly linked to improperly prepared pork. This situation could have been entirely prevented. Here are the 5 critical pork mistakes I urge my patients to correct immediately, backed by medical research and clinical experience. Mistake number 1. Undercooking pork and trusting color alone. Many people still believe pork is safe when it's slightly pink inside. This dangerous myth persists despite clear evidence from the Food Safety and Inspection Service, showing that color is an unreliable indicator of doneness. Pork must reach an internal temperature of 145 deg, 63 deg, followed by a 3-minute rest period. This temperature kills potential parasites like Trichinella and bacteria like Salmonella. Invest in a quality food thermometer. It's a small price for preventing serious illness. Mistake number 2. Cross-contamination during preparation. In my practice, I frequently see foodborne illnesses that stem from improper handling rather than the pork itself. Using the same cutting board or utensils for raw pork and fresh vegetables creates a perfect scenario for bacterial transfer. Studies from the Journal of Food Protection demonstrate that bacteria from raw meat can survive on kitchen surfaces for days. Maintain separate cutting boards, wash hands thoroughly between tasks, and sanitize surfaces with appropriate cleaners. Mistake number 3. Consuming processed pork products regularly. Perhaps the most concerning trend I've observed is patients consuming bacon, sausage, and deli meats daily without understanding the consequences. The World Health Organization classifies processed meats as Group 1 carcinogens, the same category as tobacco. Research from the International Journal of Cancer shows that consuming just 50 grams of processed meat daily, about 2 slices of bacon, increases colorectal cancer risk by 18%. If you must enjoy these foods, limit them to occasional treats rather than dietary staples. Mistake number 4. Ignoring quality and sourcing. Many patients don't realize that pork quality varies dramatically based on farming practices. Conventionally raised pigs often receive antibiotics and growth hormones that can impact human health. Data from the Centers for Disease Control shows concerning links between antibiotic use in livestock and antibiotic-resistant infections in humans. Seek out pork from farms using sustainable practices. While this may cost more initially, my patients who make this switch report fewer digestive issues and better overall health. Consider it an investment in your well-being. Mistake number 5. Improper storage and thawing techniques. Leaving pork at room temperature to thaw or storing leftovers improperly creates dangerous bacterial growth opportunities. Research published in the Journal of Food Safety demonstrates that bacteria multiply rapidly between 40 dec and 140 dec, 4 dec 60 dec. Always thaw pork in the refrigerator, never on the counter. Refrigerate leftovers within 2 hours of cooking. When I explain these simple rules to patients, many are shocked at how they've been inadvertently risking their health. What continues to surprise me is how even well-educated patients make these mistakes. Many assume that traditional cooking methods passed down through generations are safe, despite significant changes in food production systems over decades. The patients who implement these changes consistently report better digestive health and fewer unexplained symptoms. One patient who suffered from recurring digestive issues for years found significant relief after correcting these pork handling mistakes. Remember that proper pork handling isn't just about avoiding acute illness. It's also about preventing chronic health issues that develop over time. The nitrates and preservatives in processed pork products have been linked to inflammatory responses that can exacerbate conditions like arthritis and heart disease. Studies from Harvard Medical School suggest that replacing processed red meats with unprocessed options or plant proteins can significantly reduce inflammation markers in the body. This simple dietary adjustment can have profound effects on your long-term health trajectory. For patients with existing health conditions, These precautions become even more crucial. Those with compromised immune systems, pregnant women, and the elderly face substantially higher risks from foodborne illnesses that might cause only minor discomfort in healthier individuals.